today. Thank you. Bailey told me that was going to happen. Yep. And I should mention that for everybody as well. This meeting will be recorded. So if you want to share it, it will be on our YouTube channel. It will live up there for the rest of everybody's lives. So referring to this, and can you imagine in 5 years, we're going to see this video and look back and go, wow, can we believe what we were all dealing with, 5 years ago with this pandemic and all the craziness. So, this is a time in history that it's my first pandemic. And it's just really, really wild, right? This is a time to be very pivot. There's that word. It's a time to have a lot of grace within our network of friends, our family, our community, and just try to understand and love each other. Honestly, this is a time for love and compassion. If there's anything I've learned through all of this, that's number one, to care about others, no matter what their stance is on anything. And we're all human, we're all in this together. So how can we help and support? So that leads us to our event today, which is West Des Moines Edge. We started this through COVID, and it's really a great way to look at our key core industries that are vital to our region, to the city of West Des Moines, and healthcare. We are a healthcare mecca. Think of all of these incredible employers we have here and people that are serving our community. And so I'm so excited that today we have Richard Greene, Thomas Mo Rooney, Ben Valliere, and John Vanderveer, and also Mary County. So these folks represent our top healthcare, medical device, biotech, life sciences, you name it. They're working in all facets. So they're going to tell us a little bit about their industry. Of course, we are going to touch on COVID. That's critical right now. So great to hear that the vaccine got approved fully by the FDA. Clap, insert clap here. Woo, 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 right? So, and then we're also going to talk about the future of healthcare, what that looks like for our city and for these amazing professionals that are with us today. So I want to thank each and every one of them for imparting their words of wisdom today. So I am excited to introduce our team. Bailey first heads up this event today and our marketing, social media, and events. Kara Matheson is in charge of our workforce development efforts. Anna Dowd in charge of membership and strategic partnerships. And Nicole Langmaid is our operations leader. And I'm happy to introduce Tom Florian, our director of membership and growth. And he is going to help support our sponsor. Thank you to Bankers Trust for supporting this event today. Take it away, Tom.
Well, thank you, Catherine. And again, thank you all for joining us this afternoon for today's webinar. Very relevant topic, and we're grateful for our leaders for joining us for today's panel. Today's presentation and this West Des Moines Edge series would not be possible without the support of our sponsor, Bankers Trust. So did want to give a quick shout out and introduce Rob Reiner from Bankers Trust to provide a few remarks before we begin. Rob, take it away.
Thanks, Tom. Again, as I've mentioned before, Bankers Trust was just happy to be a part of the West Des Moines community. It took us a number of years to find that and finally move into West Des Moines and find what we love to be in here and to join the business climate here. Even though we were not physically located, we were right on the fringes over there on our Clive office. We're located at 620 South 60th Street. Happy and excited to continue to grow in this facility. And again, just always a wonderful feeling when we get to join the West Des Moines Chamber with events that they've put on. You guys put on some fantastic events, and we're just happy that we can be a participant. Thanks, Tom.
Thank you so much, Rob. We really appreciate it. And we have events for everybody. We have webinars. We have a few in-person events as well. So we have something for everybody for your comfort level. So happy to support the community and provide those key connections for our community. So I am excited to introduce Richard Greene, a dear friend of the West Des Moines Chamber. Richard Greene is Chief Operations Officer of DMOS, so Des Moines Orthopedic Surgeon Orthopedic Centers. And they have a brand new website, which is amazing. I have been there physically for many ailments over the years, and including my kids' broken bones and such. And I just can't tell the crew here that they do outstanding work. So thank you, Rich, for all of your words of wisdom today.
You bet. Happy to be here. I'm going to try to save or do a PowerPoint here. If I can do that. Danielle, I'm gonna need your help with that part real quick.
Yep. Okay, so they need to let you share your screen like this. Here, share. Okay, and then there you go.
Perfect. Go back a little bit. Okay, so one of the things that we learned as we look at pandemic in the last 18 months is that orthopedics, the line of work that we're in, is a very elective discipline. In other words, people don't have to come here. So we need to really look at the things that need to occur in order for patients to be taken care of as we move forward. So one of the things we looked at is, what have we observed in the last 18 months or so since the pandemic started? And these are 4 key areas that we looked at. And the first one is that people have an incredible capacity to adapt. We all go through courses and talk about change and how difficult that is and things of that nature. However, what we did observe is that when change happens in a situation like a pandemic, people adapt to it and move on. And one of the examples that we brought up before this started was messaging that we put out at the beginning of the pandemic that would result in angst and things of that nature. Recently has just been, okay, move on. What's the next step? Which is one of the things that really helps as we use the word pivot and move to the next level of what we need to do as an organization. The second part we found was that creativity comes from all areas of the organization. We had a period of time where we had very minimal patients coming through our building, which was somewhat spooky, really stressful, because the worst thing you can have is orthopedic surgeons with nothing to do, which was a little bit of a challenge. But we looked at challenging all of our folks to come up with creative ways to do things better. And some of the ideas that came out really did affect the patient experience and help us move forward as an organization. The other part that we knew and we're growing towards and really was, again, highlighted by the pandemic is that healthcare is a consumer-driven process, meaning people have choices now. When we first started doing healthcare, you think about 20, 25 years ago, you went to where your doctor told you to go. Now you have a choice, and we need to meet that choice head on. And the last thing, which Catherine talked about when we began this presentation, is that kindness is very simple and goes a very long way. It's not easy, but it's simple. And doing the simple things better is what really separates us as an organization, and that's what we try to do. And kindness is something we need to show all of our patients, because a lot of people are going through a lot right now. How did we adapt our work? Well, several of our jobs went home and won't come back. We hear about outsourcing, but overall, we kept most of our people in our organization. Our people are our culture, and it's hard to have a culture if people aren't here. The other side is we're a service-oriented organization, so it's very difficult to provide service with no one here. But we did learn that as you go through the trials and tribulations of a pandemic, people grew stronger, and that really did support what culture we had. How do we adapt our clinics? Well, we emphasized access, which means, what does a patient need now? How do we get to them quicker? You think about people don't order pizzas by calling anymore. They go onto their phone. Healthcare is not that far off from that, and we need to adapt to get to that point. I know others within our presentation today are all doing that. You see healthcare kind of moving in that direction, which is very important and very crucial to meeting the needs of the consumer/patient. And then last, how do we navigate the never-ending information stream? We see that now between the CDC, the World Health Organization, not WHO TV, Facebook, Snapchat, and of course Twitter. Communications coming from all different directions. How do you work with that? Well, we applied those C words: make it clear, make it consistent, make it concise, and then move on. It's okay for people to talk about some of the things that we've dealt with, whether it be mask policies or vaccines or things like that, but we all drive it back to what's best for the patient to create a safe environment and move from there. And that's been helpful as we've charted our way through what seemingly was almost over, and now we're back through a wave. Hopefully this is the last wave that we see of a pandemic. So what's left after 18 months? What do we see? Well, we see a higher consumer demand with the more sensitized patients. Patients come in much more revved up, stressed for very good reasons. And how do you attack that? How do you counter that? Well, we do a lot of education, a lot of discussion about emphasizing kindness. Simple goes really far. Simple things like walking a patient back, listening to them, asking them how they feel, things of that nature. Emphasize patience for staff, for both those that we work with, and then those that we're helping out as well. There's a really powerful a video vignette. Cleveland Clinic puts it out that shows patients walking in and out of a hospital, and above their head are little balloons of what they're thinking. And it does drive you home for an organization where we have hundreds of patients coming in our doors every day, what different perspectives each of them have. And having patience for those patients that may be a little more grumpy, because that's something that we've noticed from everywhere from our front desk to our physicians, is that patients tend to be a little more revved up. And then how do we accept that, move on, and help them get to the next place? And kindness and patience are the way that we do that. And then emphasize communication for both the patient and the physician in terms of what's the next steps for how we're taking care of the patient and what they are to expect as we move forward. So as far as a consumerism and consumer-driven process with healthcare, for us, it means access. It means having urgent injury clinics where instead of patients having to go into the emergency department in a hospital, they can come see us, which helps offload that burden. Having physical therapy, interventional therapy places where patients come in off the street and get started with their care. Extending the experience into their home via IT solutions, being able to send secure text messages, video. Telehealth's a big one. I know Ben will probably talk about that with Iowa Clinic. They do a lot of telehealth, which is great in a primary care setting. A little bit more difficult in orthopedics as we're putting hands on patients a lot more, but things that we're certainly open to looking at doing. Feedback, having active listening. We have a patient experience director that works with all of our patients that have issues. We get a bad Facebook post. She goes and contacts a patient and discovers what can we learn from that experience. And, every problem's an opportunity, and we've been able to really execute and gain some advantage on these opportunities by just listening to where we're going wrong and make a change with that, and hopefully buying a patient for life because we've addressed some of their concerns. Social media, incredibly important. I remember a day I was working at one of the local hospitals, and the policy came out: no social media, don't get on social media, don't tweet, don't do anything. And within about 18 months of that, it was just the opposite. Social media we need to use as a constructive tool to get our word out and our message out, and we've done that. It's been very effective. It's got some bad sides as well, but it's been effective if used correctly. And then living outside your walls, again, being able to extend the reach into the patient's home so they're not waiting to come in to see us. We can go in and see them in a manner that they approve. So what's next for us? Obviously, consumer-driven care, as we've discussed that several times. Again, orthopedics being elective, we need to meet the patient at where they are. Iowa being a state that it is, where it's a little bit of an older state, we know that osteoarthritis is a big diagnosis code and something we're going to see a lot of in the next 5 to 10 years. So preparing for that, and then extending our culture into the community, that culture of kindness, the culture of patience, and being able to take care of folks for where they are and what they need at that time. So we'll throw that back to you guys. Catherine, hopefully I didn't go too quickly with that.
You're great. You're great. I wrote down some of your neat ideas here. I love the kindness, and simple goes a long way. And we can probably all use that in every facet of our lives, everywhere
Absolutely.
we go. That's wonderful. And I don't know, this might be on a t-shirt, but have patience with your patients.
Yeah.
It's kind of a double entendre, but I see a little marketing idea there. And I love that you said every problem is an opportunity. Again, something that we can apply not only in the healthcare setting, but in all of our lives. Every problem is an opportunity to look at it, see it from all angles, be innovative. And so thank you so much, Rich. Really appreciate it. You guys are doing great things. I love your videos on your website too. Really, really neat stuff. So thank you so much for being here. So, well, speaking of innovation, we have next Mary County, who is Chief of Staff, Innovation and Advocacy for Mercy One. And I'm excited to hear how she innovates and the folks at Mercy One innovate. So Mary, it's so great to see you. Thank you for your time.
Excellent. Thanks, Catherine. Can you hear me okay?
Yes. Oops. I accidentally muted you. You may want to unmute yourself. Thank you.
Can you hear me okay?
Yes.
Okay, wonderful. Thank you, Catherine, and to the chamber for having me. Great to be here with you all today. You can see my screen, correct? Okay, again, as Catherine mentioned, my name is Mary County. I serve as Chief of Staff, and really my main focus for the Mercy One system is around strategy and advocacy and pulling into different innovative initiatives as they come about. And I'm going to just highlight a couple different, I'd say, bright spots that were maybe in the works before COVID, but COVID really allowed us to shine and accelerate some of that work. So I just want to provide a little bit of background on our organization. So Mercy One, if you just see on the slide ahead of you, just looking at our mission, values, vision, and cultural beliefs. As you can see, our mission being our unique purpose is essentially the Sisters of Mercy, when they started our organization in 1831, is really our unique purpose. And it still exists to this day. And of course, our values that guide us and our vision. I'll call that out because I think that this again really rang true during the pandemic in terms of setting the standard for personalized and radically convenient as a system of health services. And like I said, that in some cases where we thought when we were closed down or had to really pivot to a different way to deliver care, it really brought forth some incredible learnings, in which I think we even surprised ourselves and hopefully can continue to carry those through. So Mercy One, if you just look at us by the numbers, what I want to call out on this though, especially if you look at our footprint, I'm going to show you on the next slide, with over 420 care locations and employing over 20,000 colleagues. I'm going to call out our colleagues right now because they have been through a lot. And unfortunately, I don't like the space we're in again today. And especially given we have a big shortage right now from a nursing perspective. And we're at a worse point where we were during the middle of the pandemic, but that's because we've had high turnover, there's burnout. We're really concerned about many of our colleagues, not just nurses, their overall well-being, because the pace and pressure in this current environment is just immense. What I'd call out though on the left side of the screen is just to notice, because I think sometimes it's a bit maybe not always clear in terms of when you look at our business model. Of course, we don't want people to end up in the hospital. We want to be proactive and keep them out of the hospital. And you can see that we touch 3.3 million individuals outside of the hospital setting. And I think it's really important because you're going to see in my next point, when you start to talk about telehealth and looking at care at home, that we really have to adapt to consumerism. And, COVID forced us to do so. And I think we're going to continue to see that into the future. Moving on to our footprint. So Mercy One, we're a partnership between two of the largest Catholic healthcare systems in the country, Common Spirit and Trinity Health. We oversee 43 hospitals across the state. You can see our footprint here with a presence in Sioux City, Mason City, Des Moines, Waterloo, Cedar Falls, Iowa City, Dubuque, and Clinton. And as you can see, kind of the hub and spokes, those are our rural affiliates. We own 8 of those rural affiliates. The rest of them we manage. And so those are the majority of our hospitals in Iowa who are part of our system. And you can see the little red dots are our ambulatory locations. So moving on to the COVID impact, I'm going to take us back because some of these numbers are quite startling. But again, I think it's important to recognize that even though we're in a better space, at the same time, some of these numbers, the concern is, what does that mean for us, for our workforce, for our overall economy? But moreover, from a healthcare perspective, there was a big delay in care. So as you can see that, to look at 55% of Americans saying that they skipped or delayed care during the pandemic. Now, of course, we were closed down, but we tried to pivot to the telehealth channel as a way to deliver care, but that wasn't maybe the comfortable setting for individuals. And therefore too, they may have not felt comfortable to come back into our clinic setting amidst COVID. And of course, as you look at this too, hold on, let me go back up. In terms of just the concerns of re-engaging with the medical system. I know that many of those still exist. I still hear about people who aren't comfortable leaving their home. They're definitely not comfortable coming into a hospital or a clinic. And so again, just really trying to make that pivot. And then furthermore, if you're looking at the economic impact, which I still think we're all trying to work through in terms of the CARES Act funding and what's come out and other stimulus that may or may not be moving forward through the infrastructure bill or other means at the federal level. But I think you can see through job loss or furloughs or those, like I said, in our industry who have simply left their jobs and maybe possibly early retirement and whatnot because they just were so fatigued through the pandemic. Moving on, you can also see that we know a lot of that with job loss. How is that going to affect healthcare utilization? What did that mean in terms of insurance? And let alone if that impacted whether or not somebody was going to continue to come in for their annual checkups or whatnot. And so, of course, we know that we saw that. And some commercial payers or other payers we saw who stepped up because utilization was down and actually gave those dollars back. And I think we've also seen that here when you looked at how unemployment was up. And luckily, Iowa was in a much better spot. But again, and I think we're also lucky that when you look at these numbers of what we anticipated to be down revenue-wise, we were fortunate that I think that we were covered well. But again, trying to look at what that means as you hear and you go into a restaurant and there's one server for an entire floor. I think everybody's still struggling with, again, just not enough bodies and how do we really get back to a more stable situation. So what did we learn from all this? And these, I'd say, are really the silver linings through the pandemic. It was just really incredible to see our Mercy One colleagues rally around this one common mission and purpose, which was to save Iowans. We had a sense of urgency. We really had to pull together as a system cross-functionally across the state. And whether that was moving a pulmonologist from Mason City to Sioux City when the surge was occurring in Northwest Iowa, but also it led us to rapid decision-making. I'll get into that with advocacy. We didn't have time to sit and stew over, do we do this, do we do that? It was in some cases on the minute or the hour where we were working on adjusting to working in each of the counties in terms of what was occurring there, but let alone with the state. But it really forced us to be one. We had to focus on clear coordination and really ongoing communication at a very fast pace that became extremely important to try to keep our 20,000 colleagues in the loop and up to speed with ongoing changes with waivers and regulations and how we could actually manage our operations. And then I'm going to call out the middle one, nimbleness. I think this was absolutely key in terms of, again, I'd say what surprised us. And I will call out that I think we all learned. Not only can healthcare move fast, so can government. And I think we saw that we just didn't have the ability to be complacent in the middle of a pandemic. And with that singular focus, it really forced us to all come together to collaborate. We work closely with Unity Point, with the University of Iowa, with Genesis, with all of our rural affiliates in an incredible fashion. Because we were forced to with surge planning to ensure that no single hospital was overwhelmed. And that was truly a bright spot. And we try to maintain that working through, and especially with our congressional delegation. I'd also say another bright spot in terms of being nimble is that we worked with Corteva, and who would have thought a healthcare organization would be coming together with an ag company to develop a testing capability. And so we did that in terms of expanding COVID testing. And it was a wonderful story in terms of those two, our organization coming together with another Iowa company to be able to do that on behalf of Iowans and expand that to across the country. So the two learnings I'm going to share really quickly are telehealth. If you look at this, just really quickly, I'm going to call out a couple numbers. If you can imagine, we went from 12 providers, that's 12, 2, to 700 providers providing telehealth. And we went from 100 virtual visits a week to 50,000. You know, we were shut down. We had to continue to deliver care. So not only did our providers have to pivot, but consumers did. And so that was really critical to really force us. What an incredible catalyst to force us to be innovative. And I think, again, a great story that we hope to carry through into the future, because we know consumerism has changed dramatically, but also we know, and that's part of what I'll get to next, telehealth parity, which basically means we are advocating with the federal government and the state that it's important we're reimbursed at the same level as an in-person visit, because if we're not, we're worried that that's essentially going to diminish right now how many providers want to be in that space. And we know that consumers are equally happy, if not more happy, with that service, being able to be on FaceTime from their couch. And we also know, therefore, then they're less likely to miss that visit because they're able to receive care when they want and where they want, if we can provide the right level of care. You can see here, and I'll just call out on the far left, this is an important figure because this is when, if patients don't receive care, they get sicker. And guess what? Then they end up in our ED. And then that's what affects the total cost of care, and that small percentage for the most of our cost across healthcare. So if you think about patients that would have been able to come in otherwise, it was really important that we were able to maintain that continuity of care. So moving on, I'm just going to call out advocacy because this is under my umbrella, and I think it really is a bright spot in terms of really teaching us how not only was it so critical that we were working hand in glove with the state, because we became an extension of the public health system. If you think about the Iowa Department of Public Health, look, they don't own hospitals. And by and large, they were dependent on us and our facilities. But of course, we were dependent on them to give us some regulatory relief and provide the resources we need, whether that was dollars or whether that was actually nurses at the height of the pandemic. But to me, this was really the cycle where it seemed to come very slow but fast in March of 2020, and that we were told all of a sudden, end of March, stay at home. Then businesses were closed. Then it was PPE. We didn't have enough gowns or masks. Then it was testing. Then there was a bed shortage. Then there was vaccine supply shortage. And now we're trying to become stable and strong into the future. But right now, then we're dealing with not only the Delta variant, but compounded too with just more acute patients, sicker patients, let alone our staffing shortage. So of course, now we're kind of back on the radar of our federal delegation, along with the state, the governor's office, and IDPH. So continue to work through that. But this just showed that ongoing communication, this was key. I'll highlight some of those pieces tactics that we used. And you know what? Relationships matter. This was so key because too, if you think about, there were no in-person conversations. So it was a lot of phone calls. Then we quickly had to pivot to Zoom. We all obviously got a lot more comfortable with Zoom. So we were doing town halls with the legislature, with our CODEL. And then education, it was really an opportunity to educate them on other issues around like 340B, our Medicare reimbursement. And so that again was an opportunity for us to really kind of highlight our organization and also alongside our healthcare heroes. But we also had to be solution oriented in terms of knowing we didn't have time. So it was really, what's the next? If it was Test Iowa and we didn't have enough testing and the lines were long, we had to figure out how do we supplement nurses for the state. And so it was constantly trying to come up with those solutions, again, because we really didn't have time to sit on our heels and wait for any other options. But here's how we advocated. And again, I'm pleased to say that a lot of this work has continued. We have regular calls with Senator Grassley and Senator Ernst's office, for example, with the University of Iowa, with Unity Point, with Genesis. So we, as Iowa, as the health systems, are advocating for those kind of systemic and statewide issues. And this was really key during COVID, and especially when we were closed and we were desperate for funding. And I'd say, again, we had a large letter writing campaign, but again, it's really kind of allowed us to step up and appreciate how important it is to advocate for our organization and recognizing our employees, our constituents. And then next, just as I said, ongoing calls with the governor's office, working with Medicaid, the insurance commissioner, and especially when utilization was down, and IDPH. I mentioned town halls and also the Mercy One op-eds. But again, just a lot of good work in terms of really understanding how are we able to elevate our organization during this, working hand in glove. And again, I think it was an opportunity to highlight Mercy One, but also the organizations across the state, unfortunately during a pandemic, but again, looking at the bright spot of those things like telehealth that can be carried through, along with our strong relationships and standing that we have with our congressional members. So Catherine, I hope I didn't go too long, but that's the end of my portion.
That's amazing, Mary. It's kind of mind-boggling, 50,000 virtual visits a week, just imagine. And yes, if you're not getting the same, reimbursement as you would an in-person visit, that would just mess up the entire system. That's just incredible. Your nimbleness, sense of urgency, and I love the innovation in the Corteva partnership was so cool to see these two organizations coming together. I love that. And that's innovation in its at its best, right? That is so neat when we can do things like that. So thank you so much, Mary, and thank you for your leadership. I am now so excited to introduce Tom Mo Rooney. Tom is on the West Des Moines Chamber Board, so we adore listening to Tom's updates. He said earlier, hopefully they'll be more positive in the future. Yes, let's cross our fingers about that. Tom is VP and Chief Operating Officer of Unity Point Health in Des Moines. So take it away, Tom. Thank you for being here.
Well, Catherine, thank you, and appreciate the opportunity to be on this panel today. First and foremost, I want to say a thank you to all my healthcare colleagues. You see a lot in the media right now around the stress within all of our healthcare settings, and I don't know that the media fully captures just how stressful it is. So to all my colleagues for all their hard work and continuing to show up every day, it is a joint effort that's going to get us through this. So just very much appreciate all that as well, too. For my comments today, I'm going to go a little bit different direction. I think there's some things that apply to healthcare organizations that also apply to every business out there that I think we have to be mindful of going forward. And while certainly all of us in healthcare are thinking, what do we need to do in the next 24 hours or over the next week or so? There's obviously going to be some things that are ongoing, not just in terms of the next several months, but I think all of us as business leaders need to start considering the business impact over the next several years from COVID as well, too. Because the disruptions we're seeing are likely not to go away for a long time. And I want to highlight two areas of this. This is not an encompassing list, but two areas that I think are particularly going to be challenging to all of our businesses going further. Going into the future. So first is the supply chain. Obviously, we have seen incredible disruptions in all of our supply chains in various ways, whether that's been for our businesses or even just the consumer goods that we have at home. But we also need to start looking at from a worldwide standpoint and consider, as much as we want to see in the United States, COVID vaccination rates go up, much of the rest of the world hasn't even had access to the COVID vaccine yet. The implications for that in a worldwide economy where we are dependent on certain countries for certain products or raw materials is that.
Okay, I think Tom froze a little bit. Is everybody else on? Everybody give me a wave. Yeah, okay. Okay, good. We'll give Tom a second. This is the technical issues that we all are used to now, right? We used to panic when these things happen, but now it's like we have some music. Don't we have music, Nicole? We can key up for a minute. She's laughing at me right now. I know she is. Here's what we're going to do. Let's go ahead, and if we're good with this, let's bring Tom back on after he gets reconnected. And we are going to, we're at 12:33. I love to end these right on time because it's so critical to keep everybody's schedule intact. So we're going to go ahead and move to Ben Valliere. And Ben Valliere is CEO of the Iowa Clinic. He is fairly new at the organization. I was trying to recall today when you started. Was it June or July? Am I close, sort of, Ben?
Yep, last August. So you're right on.
All right, awesome. Well, thank you for being here, Ben. And then we'll bring Tom back on when he gets his technical stuff worked out. So thanks, Ben.
Thank you, Catherine. And I appreciate the comments from the other panelists and certainly the work we all are doing in the community and the opportunity to partner with all of you. I'm not going to talk a lot about COVID. In fact, I'm so sick of talking about it. I'm going to take this as an opportunity to go in the opposite direction and try to get a little bit more global as we talk about the future of healthcare in our community, especially as it relates to us as employers. I think we have a really important role to play that we don't always assent to in a way that we potentially could. And I think that's because healthcare is a black box that many of us have a hard time sort of cracking into, and it's a little bit meant to be that way. It's sort of this self-sustaining system that becomes very hard to break into and to really understand. And I think business leaders have had just about as much of that as they can take. There are roughly, I think it's 160 million Americans employed with they receive health insurance through their employers, and yet those same employers oftentimes, I would venture to say most of them, feel victimized by the system that they and their employees are financing. And I think that's got to stop, and I think we have opportunities to do some things differently. So when I think about the future of healthcare, I believe we will see significant disruption to the status quo led by mid-sized and large employers, just like many of the folks on this call today. And I think it's incumbent upon us, as this disruption happens, as healthcare providers, folks like the Iowa Clinic, to really step it up in terms of providing transparency, affordability, and accountability for the outcomes, for the clinical outcomes and the financial outcomes of taking care of our customers, your employees. And as stewards of our community's healthcare, I think that's completely appropriate. So, and as a medium-sized employer and a healthcare provider, we really share that frustration at the Iowa Clinic, especially when we see annual benefit increases of 5, 7, 10, even 12%. When you throw on top of that COVID, the disruption to revenue streams, additional expenses, a national labor shortage, and the accompanying wage pressure, what we have, in my opinion at least, is absolutely not sustainable. And unfortunately, the system as it's constituted today is 100% set to continue this trend unabated, but for innovation that we as business leaders can bring to the table and work together to change the status quo. And I'm really passionate about that, because we can't just continue to pass on costs to our employees in the form of premiums, high deductible health plans, and co-pays. That will never catch up with healthcare inflation. It's not enough. It's not even close. So I think going forward, we as employers are going to have to think about the healthcare that we provide to our employees, just like any other major operating component of our system, or any other major overhead component. We're going to have to actively manage it for the first time in many cases, and it's something we'll have to do differently. I think we've seen over the last year that Iowans deeply value choice, right? Our employees deeply value choice, particularly as it relates to healthcare. So that's something we have to be sensitive to, but I don't think it's something we have to be afraid of. We got to think about how do we help our employees make choices empowered by data and aligned with incentives, so that they're working with their employer, and their employer is working with their healthcare provider to move this stuff forward without these extreme annual compound cost increases. It's unsustainable, and it's unnecessary. So over the last year, as we've sort of in the moments we can take a breather from COVID and kind of get some time away from all that madness, we've spent a lot of time thinking about how we can take our experience in this area and help our employers in our community bend the cost curve in Des Moines, Iowa, so that we don't have to continue this trend the same way that we're seeing in every other market around the country, and particularly in the Midwest. So I'm encouraged by the results that we've seen. I'm excited about that. And I would encourage each of you, especially if you're kind of 500 employees plus, to really push your brokers and your consultants to talk to you about the micro data, the total cost of care, and the outcomes associated with that care, the clinical outcomes, because we can take better care of our employees, and we can do it at lower cost. And so I'll get off my soapbox. I'm passionate about this. I think we have so much opportunity as a community to do this better. And most of all, I'm passionate to not be talking about COVID-19 on a conference call. So I appreciate your indulgence there, and I would turn it over to the next panelist. Thank you.
Neat. Thank you, Ben. Thank you, Ben. Have you written an op-ed maybe for one of our local newspapers by chance? It's I like what you're saying.
Well, I haven't yet, but I'm happy to do it.
Yeah, it would be a great idea. I think we could all agree with you, bending the cost curve, innovation to change the status quo. We're using the word innovation a lot today. I love that. But supply chains, boy, talk about every area of our lives being rocked with the supply chain problems. And I love your 3 words: transparency, affordability, and accountability. There you go. Those are 3 key words. And yeah, well, thank you for all your passion around that. And nobody likes the increases every year. And how do we keep that going, right? How do you sustain that? So very interesting. Would love to learn more about how you do that. All right, so we are going to introduce John Valliere, who is founder and CEO of Exemplar Care, who is fairly new to our region and kind of a new healthcare model. So excited to learn about that. And we're also hope Mo Rooney can join us again as well. So take it away, John.
Thank you, Catherine. Thank you, everyone, for being here. It's been fascinating listening to everyone so far, and everyone's done a really good job. I have to say, though, Ben just took the bat and hit it out of the ballpark. So the things he's talking about, change in healthcare, is a lot of what I was going to talk about as well. So we have a different kind of model, and it's kind of like your Amazon Prime. There's a membership, there's a setup to come in, be seen, text with your doctor, have virtual visits, like Mary was talking about. All of those things I was doing before COVID ever hit. And Ben, I'm not going to talk about COVID, even though we do an endless amount of testing. I think it's really important, and the consumerism thing has been brought up over and over. So I was going to talk about that. That's clearly a horse that's been ridden. But I think a couple things that need added into this conversation. One is behavioral health is real health. I think we've all seen that, and integrating primary care, whether it's in the fee-for-service model or in our kind of membership-based Amazon Prime type model, having behavioral health readily accessible in person, virtually, is very important. The impact I've seen in my practice on individual clinical outcomes when the behavioral health isn't being addressed as well as it could be is really profound. And those costs obviously get passed along directly to payers, whether that's the insurance or the employer who is doing that. I think back to what was just said is the model needs to change, especially for the employer side. Healthcare costs are breaking businesses to the point where they're now passing them on to their employees through high deductible plans and other things that are basically cost shifting mechanisms. And I don't think we change the care model and take better care of people until we can change that financial model. And that financial model is along the lines that Ben was saying. And all of the people, Mercy One, Unity Point, Iowa Clinic, and Des Moines Orthopedic Surgery are all organizations that have the power. And I think this is kind of the takeaway I've got as I've listened to everyone is one person who's absent from this conversation is our friends at Wellmark. But the folks on this call and the organizations have the power to bend them as much as we do, along with employer groups, to go in and say, we need a different way in which we finance care. So forward looking, I would like to see the cooperative competition where people are working together for the total good of the system, and that's for the employee workforces in West Des Moines and the rest of the metro. And if you don't take those, if we don't work together in moving how those things move forward, we're not going to get there. We're going to keep having kind of that same churning through the systems. As was said earlier, it's kind of a self-preserving system that protects itself, and you have 3.3 million visits when maybe 3 million would do if you could find alternative ways in which you can care for folks. So those were kind of my big points. I think there's two other points that are worth just slipping in under the radar, and then I want to be conscious of time. Is one, primary care is making a resurgence. We see this in nurse practitioners, PAs. Very importantly, medical students are starting to go into primary care fields. And it's worth noting and reminding all of you that the United States has half the percentage of primary care workforces as the rest of the developed nations at more than twice the cost for the same care. So it's important to remember that primary care impact is really important. So having a primary care doc and having access to your doc, not, I know they call the clinic, we can see you in 3 weeks, being able to see your doctor that day makes a huge impact on people's lives. And there are ways in which we can do that. And then lastly, I think we talk about all of these things, and they're all really important, but the most important and the only one, and everyone on this call should know this, the only thing that's ever going to change the healthcare cost trends and trajectory are diet and exercise. These are not glamorous, they're not sexy. Truly terrible at both of them myself. But those are the only things that prevent disease and prevent future cost. So I will hop off of that soapbox. That's where I get really excited. And I want to hear Mr. Mo Rooney if he's back, and otherwise open it up to questions.
I like that, boy. And you brought it really to that personal responsibility, John. Diet and exercise. Yep. And we all work so hard. It's so hard to put that exercise component in our lives, right? We can, diet is and can be easier than how do I put the exercise in the day? Crazy. Thank you, John. I like everything that you said. It sounds amazing. And it sounds like everybody's kind of on the same page, working together though. I love that idea. You know, we can all work together for the total good of the system, which helps everybody in the end. So thank you for your wonderful thoughts and ideas and innovation. There's that word again. So we do have Tom Mo Rooney back. So Tom, you just started to tell us your great story, and we're going to bring you back, and appreciate your patience with all of the technology today.
Well, I'm sorry about that, and hopefully if we get disconnected.
Oh, darn it, darn it, darn it. Is everybody, okay, Tom is still frozen, right? Okay, we've got some waving. All right. Okay, Tom, you are muted. I can see that. There we are.
Are you able to hear me now, Catherine?
Yes.
All right, I'll try without a video. Maybe that will help here. So I apologize for that. I think the part that I would just add on to maybe what's been said by others as we look at costs, I think we need to start considering the overall COVID cost into the equation here as well too. And I think that this is particularly going to be an issue as we consider what happens next with the vaccine rollout. And the reason I say this is just yesterday, there was some data released by the Kaiser Family Foundation that looked at hospital admissions for COVID patients in June and July in the United States, and particularly those hospital admissions they considered avoidable. And their definition of avoidable was the patient vaccinated or not? And there happened to be 113,000 patients admitted to US hospitals that were considered avoidable hospital admissions just in 2 months. The total cost of that care was $2.3 billion just for the hospital care. And that's not any other lost productivity, wages, anything else, just the hospital care. So as we start to talk about the impact on health insurance premium,
Darn it. Okay, I can't hear Tom. Can anybody hear Tom? Okay, okay. We hear some shaking heads. Very interesting fact, 2.3 billion, 113,000 avoidable hospital visits just for the hospital care. That's amazing. Get vaccinated. Tom, I think you are muted. If you unmute, we'd love to have you back. Okay, you're unmuted now. Can we hear you?
I can hear you, but it's not working. So we'll just move on then. So
we can hear you now though.
Oh, okay. Well, just to finish, I think when you start seeing those kind of costs, I think employers are going to have a lot to wrestle with in terms of how they deal with those costs in their insurance premiums and what implication that means as they assess ongoing vaccine mandates, because
okay, this is what happens sometimes, right? So yeah, we've all been there 1,000 times. And yes, so Tom, I'm sorry we can't hear you right now. You might be able to hear us, but really appreciate it. We do have a few extra minutes. If anybody has any questions that you want to supply in the chat, we do have 10 minutes. So we've heard from a lot of amazing experts. And so if anybody here does have questions for our chat room, we are happy to have our key leaders here answer those. Everybody here represents kind of a different model, different look at healthcare, a different approach. And but again, we're all in it together. And it's the love and the care of our community. And you all are very huge support systems for our community. So we want to thank you very, very much. And so if we won't have any chats, then how about our panelists? Do you have any questions for any of the other panelists, since we have our key leaders here and not this opportunity? We don't have this opportunity very often. So do our panelists have any questions for other panelists? Don't mean to put you on the spot.
I'd like to ask questions about the employer space, Ben, and how you move into that, given the choice issue that you said is a problem. I always joke the community's a blue state or a green state, it's Unity Point or Mercy, and you guys in there in between. And it's I have a company that we take care of that they finally picked one and they refund all of their savings back to their employees. So I'm just curious what types of approaches folks are looking at in that employer space.
Well, yeah, I think maintaining the choice is important, and maybe more important in Des Moines than other places. So I think a lot of the conversations we're having are around how can we help you look at your total cost of care, and how do we help, where are the points that we can use to help you unpack that and look at opportunities. And it's not necessarily the same for each employer. And it's probably more complex than I could get into today, but it's astounding. It's breathtaking to me, the delta between opportunity and what's being realized today when folks just look at the existing situation and cost structure.
Interesting and great that we have the opportunity to do that, to analyze, look deep and see what's efficient for everybody. I love that. It looks like Josh has a question for Ben. And Josh, your text didn't go through. Oh, here we go. Josh has a question. What strategic initiatives or tactics should organizations start to implement to bend that cost curve and to slow cost inflation for Patelins? I'm in grad school and I try to do research on this. So it sounds like a report coming on here.
Yeah, I think some basic things you can do to start to look at the performance of your health plan is to look at all your employees, look at where they receive their care. I like to do that using their primary care provider, and there's different models to do that. But you say, hey, based on who your primary care doctor is, what's your total cost of care look like? And then from there you can unpack that into different severities, and disease states, and so forth. And it gets kind of complex. But I think starting with how many of my patients are seeing, how many of my employees are seeing a primary care doctor, doing so regularly, and then what is the total cost of care associated with those different doctors. It's a little bit nuanced and it's a little bit complex, but not so much so that everybody on this call couldn't understand it. And if you look at it very quickly, you'll start to see some opportunities, I think.
Yep. Neat. Any other questions from our audience or our panel to panel? Well, I really appreciate this opportunity. I think it also comes down to get vaccinated. That is key, right? That is critical, and stay healthy, as John mentioned, that diet and exercise component. Try all that you can to keep yourself and others within your family unit and your neighbors healthy. So that's key. Well, I just want to thank you all for being here. Thank you for taking your time. I know how very, very busy everybody is right now. And thank you to Rob with Bankers Trust for supporting this. We love the West Des Moines Edge series, which really helps to analyze key core sectors that are vital to not only the city of West Des Moines, but our region. So we love to look in depth. And thank you for kind of a futuristic look too. We love all the different models and everything that our leaders here are doing for their organizations and their communities. So we're signing off now and want everybody to take care, stay positive and stay positive and test negative. You can text negative too, but I don't suggest that. So stay positive, test negative, everybody. Thank you so much. Thank you everybody for being here. Thank you.